Welcome back to the Data for Development Conference, part of the EU Africa the Journey Hackathon. I'm very happy to welcome you back to this conference. We're going to have our third panel today. After we talked about education, we've talked about food security, and now we're going to talk about a very, very important topic, which is health and wellness. I'm very, very glad to be joined today on the panel by 5 distinguished speakers. And since we have so many speakers, I'm sure it's going to be a lively discussion. And also, if we have 1 hour, then I want to jump straight into it. Health and wellness is also one of the most important topics that we have at this conference, at this event. And a lot of the teams are bringing innovative approaches to this topic. So I think we're going to have a fruitful discussion around the role that tech has to play in this sector and what opportunities are there for startups. But before we get started, I'd like to give the floor to the panelists so that they have the chance to introduce themselves and tell us a little bit about their background as it connects to the topic. So I'll start from my right. I have Mariin Petoffer, who is joining us actually from Tallinn, Estonia. So Mariin, do you want to tell a little bit about yourself and your connection with this topic?
Hello, everyone. Like Xiao mentioned, my name is Mariin, coming from Tallinn, and I'm currently starting a startup called Mental Pin, which is a device that helps people with anxiety and OCDs to overcome the symptoms. And we also provide a platform for people to monitor themselves on a daily basis. And our big goal is to connect that data with specialists as well. So going to consumer market, but including mental health specialists to our activities.
Super. And Mariin, you actually participated in one of our previous hackathons that we did this year on the data for healthy recovery, but we'll get back to that soon during the discussion. Then we have Franck Verzefe from the United Nations. Franck, where are you reaching us from? Can you hear us, Franck? Hang on a second, we can't hear you at the moment.
Yes, do you hear me well?
Yes, we hear you. So where are you reaching us from?
I'm in Congo, Democratic Republic of Congo, Lubumbashi, and I'm the CEO of TruthPay Africa. TruthPay Africa is a startup which provide a device enable people to know if medicine is genuine or fake in less than 10 seconds, anytime and anywhere in the world. And I also work for the ITU, the National Telecommunication Union, and WHO. I lead the focus group of artificial intelligence against fake drugs.
Yeah. Super. Great to have you on the panel. Next, we have Prudence Persson from Mangea Health, who is joining us, I think, from Sweden.
Yes, absolutely right. Thank you, Joe. Great to be here. I'm Prudence. I'm a Zambian-born Swedish entrepreneur. I'm the CEO and co-founder of Mangea Health. We are a search and discovery platform for chronic disease treatment in Africa. So what we've done is we've built Africa's first digital medical ecosystem that connects the whole market in terms of geography. And we are enabling people to find specialized healthcare services across the continent in just minutes. So it's pretty amazing. I'm also currently a board member at the Swedish East Africa Chamber of Commerce, where we are the go-to platform working with the East African governments to promote trade and investment between the two regions. And there I lead the healthcare cluster and also the South Sweden/Copenhagen cluster.
Super, super. So really building bridges between Africa and Europe here. Very good. Next up, we have Isabella Notarangelo, who is from MedTech Europe. Isabella, where exactly are you at the moment?
Hello, good afternoon, everybody. I'm based in Brussels, snowy Brussels, I would say. And as João, you were mentioning, I work for MedTech Europe, which is a trade association representing the medical technology industry in Europe. And as part of MedTech Europe staff, I am in charge of coordinating the projects aimed at showcasing the impact of medical technology to patients and health systems. Thank you for having me here.
Thank you. Thank you for joining us. And last but not least, we have Professor Keo Motaung, who's joining us from South Africa, who I had the pleasure to meet a few weeks ago, and who was so excited about what we're doing here that I think you're even taking a position in one of the teams that is working at the hackathon. Is that correct?
Yes.
So give us a bit of
Can you hear
your
me?
background. Yeah, we can hear you. Give us a bit of your background and your connection with this topic.
Okay, thank you so much for inviting me, and good afternoon, ladies and gentlemen. Let me introduce myself. My name is Professor Keo Motaung. I'm the Director for Technology Transfer and Innovation at the Durban University of Technology, but I'm also an entrepreneur when I have to explain that. Why I become an entrepreneur? Because I just didn't want to train my students to go and look for a job. I wanted to train my students in a manner that they will be able to create job for themselves, because job is very scarce. So whenever they leave my lab, they will be able to translate their research into commercialization. And I think this is one of the passion that even if you can look at the university, looking at the health research that they've already been done in the university, they are not there yet being commercialized. They are just collecting nicely dust there, which we should be actually finding more solution with this health research that has already been done. So this is just who I am. And I've also got a company. The name of the company is Global Health Biotech, where I manufacture anti-inflammatory ointment for sports injuries. This was also trying to compete with those ointments in the market, those ones that you apply before, and they didn't have any ointment that you can use it both, apply before and after physical activity. With so this is in a nutshell who I am as well. From the background science in terms of health, I'm a biomedical scientist by profession.
Super, super. Thank you so much for coming to the panel and for being so active with also participating on the hackathon side. And what I'd like to have during this discussion is some touch points about, what are the most relevant issues when it comes to health and wellness to the continent of Africa, and what bridges can we build to these teams that are actively working on new solutions. So what are the opportunities for startups to act? And as Professor Motaung was saying, these young people who are very motivated to leave university or not, but to make their own job, to start their own company, where would we advise them to start? So let's have a discussion, first of all, about the challenges. What are the most important challenges when it comes to health and wellness? If we look at, the year that we're living in, honestly, in my head, 2020 and 2021 kind of feel like the same. We're still in this pandemic. We're still getting out of this pandemic. There's still a lot of challenges there. So what would your advice be to the startups where if someone was starting a new company in 2021 or 2022 in this sector, what are some of the most appetizing fields to work with? And perhaps, Franck, we can start with you. Again, we can't hear you, Franck.
Yeah.
Now
I think before starting this, we can speak about a framework healthcare system in terms of Cisco complement. So the healthcare system, we can say in the healthcare system, we have a service delivery, healthcare workforce, healthcare information system, medicine and technology, financing, and leadership and governance. So For me, the majority of African countries are unable to meet a basic requirement for good healthcare system. Poor governance and human resources challenges are linked to ineffective integration of services in a resources limited nation. I think for me that the first three challenges that I can identify are inadequate human resources, inadequate budgetary allocation to health, and poor leadership and management. I think that is the three first challenges that I can tell about.
Very good, very good. And I think you made a good point of kind of splitting this this topic into several subtopics. And I think when you talk about the role of technology, then this is a question for the panel, but where do you see the opportunities that technology can come to solve some of these issues? Is it on the human resources side? Is it on the providing the actual healthcare? Is it on the budgetary allocation?
Yeah, is it a question for me?
Yeah.
Can you repeat, please? Because I didn't.
So the role of technology, just where do you think technology can have the biggest impact in transforming exactly those different components that you mentioned?
Like technology, we can say, for example, in Rwanda, we use robots for patient to give information to patient. We also use drone in Rwanda and Ghana to deliver medicines to hospital, for example. And as my startup also do, we use artificial intelligence to detect fake drugs. And there is also in some village in Africa, there is not there are not a lot of physician. So some people create some device that can help pregnant women. So the device can take all information of the baby and send directly to the physician in the town. So the physician can give the feedback directly to the nurses in the village. So that is are the different ways how to use technologies in Africa now.
Right. Prudence, what's your take on this? What are some of the most interesting challenges facing the continent and where technology can play a role?
Thank you so much. Yeah, I absolutely agree with Franck. I think accessibility, quality of care, and distribution are some of the key challenges that we have across the continent. And what I see is that for the post-pandemic recovery, but also as the future of healthcare in Africa, is that, first of all, we need to look at the market. It's 1.3 billion people spread across 54 different countries, speaking over 2,000 languages. How do you build healthcare infrastructure that provides sustainable access to quality healthcare, but also that is affordable for the majority of our communities? So looking at the current situation right now, I'm glad to see that there's right now over 100 startups working within the digital health or health tech space in Africa. But what I see as the future is that we need to build Pan-African innovations that accelerate distribution, but also that decongest points of care, and also create an environment where you can bridge the gap between physical healthcare or traditional healthcare and digital healthcare. And doing that will require some Pan-African thinking, because there's a lot of issues also if you talk about access to quality healthcare. There's countries that have better healthcare infrastructure and others do not have, and people have to move across borders. So then you have to also think about mobility. And I think issues like the Africa Continental Free Trade Area will be very critical in ensuring that we can provide access to specialized healthcare services across the continent for our populations in a much more easy way. So I would say we need to really look into how do we create sustainable distribution models that enable Africans across the continent to access quality healthcare, but that is also affordable.
Yeah, I think you bring a very, very important topic to the discussion. I don't know how well it links with the startups that we have at this hackathon, but I'll put it to Isabella. This sort of Pan-African collaboration, or like multiple country collaborating on this sector is super important. And giving your background and your expertise, what would be some of the groundwork that needs to be laid for this type of collaboration to happen in Africa?
Thank you, João, for the question, and also for the very, very useful input shared already by the other panelists. According to my opinion, the main issue to address is indeed related to inequality in access to care. The COVID pandemic demonstrated that there are lots of possibilities in the development of digital technologies that could address this problem. I believe that in order for Europe and African countries to work, let's say, and to follow, to get the same objectives, it is very much important to exchange good practice, participate in this sort of fora, for example, where ideas can come up easily, right? So I believe that finding synergies and discuss about topics of common interest, exchange good practice could really be a way to address this big challenge of inequality in access to care, by bearing in mind that, of course, digital technology could play a major role in this.
Exactly. And I think, Isabella, you raised a very important point, which is, the types of events that we have here and we've had also in the past are a good opportunity for some of these collaborations to happen, some of this, sharing of experiences to happen between teams from different countries within Africa, but also different countries between Africa and Europe. And Mariin, you've been a part of not just this panel here, but you've been a part of the one of the previous hackathons we did with your mental pin idea. So the role of these digital tools and the work that gets done on these hackathons or these types of events, how important is it, and what type of follow-up sometimes is needed to get some of these ideas off the ground? Because when we talk about health and wellness, these are 3-day events. You can brainstorm, you can build prototypes, but a lot of the work needs to be done in the follow-up of these events. So what's your experience participating in these events and coming up with prototypes from these events?
Thank you for that question, because I think participating in this specific hackathon was crucial for our idea to take off. As you know, I started from my master's thesis, so the idea actually started from scientific research and design research, proper background. But in order to get visibility, contacts, teammates, the hackathon was like the most important starting point. But how to go forward it's exactly the same context that you get from the hackathon. Of course, you start writing different investors, VCs, and specialists, but the network that you get from the hackathon is that one person takes you to another. In our hackathon, there were mental health specialists included, so I could right away actually get in touch with them and get their patients to actually test our product. So we actually managed to get our first test groups and people interested from that hackathon as well. So it's what I've learned so far is that it's all about the network, really. It's all about the connections, because the first round takes you to the next ones.
Exactly, and I think this is, as Isabella was mentioning, this is the opportunity that that these types of events provide to these teams. And Professor Motaung, you mentioned yourself that, you know, getting the academic research, getting the know-how that is stored in a lot of these universities across Europe and Africa into practical outcomes, into solutions that have a commercial angle is not always the easiest. So what's your experience with your students? You know, how do you motivate them to get to the ground running and not just go work for you know, for an existing laboratory?
Okay, thank you so much, Joe, for that. Let me first start by saying, I always tell even the startup, even the researchers, when you designed a research or an idea, have the back of your mind of is going to be commercialized. And I think this is one of the things that in the university, we've always been stressing more on research and innovation, where it's going to be an idea, a proof of concept, and a prototype, and we stop there. We never put an emphasis on commercialization. And I think this is where most of us in the university, we are where we are in terms of having all this nice IP that are just collecting dust, if I can use that word, that cannot be commercialized. But you can't blame, because again, it goes back to who was training you as a student. If the professor didn't also understand that the research needs to be commercialized, that is also going to be difficult in terms of that. So I think we need to start doing things completely different on how, like for instance, and there's nothing wrong for the professors to publish papers, to do whatever. But if you look at the economy of the African country as a moment, it's not doing well. But if you really want to make sure that we take part into sustaining that economy, university can play a most pivotal role, because they've already done R&D. It has already been tested, safety and efficacy. Prototype has already been developed. It's already at technology readiness level 3. So what I wanted to see is to take it from technology readiness level 3 to technology readiness level 8, 9, so that it can be launched and it can be a product. Now, you will see that when you solve a problem, always make sure that you solve the problem that will benefit the society. Quite often, you see that people are doing research or they are running a startup, but then they don't know who is their market. And one of the things that I've also discovered with the innovators, or with the one that are here, even based on my experience, they get excited in terms of designing an app. This app is going to help, but one of the things that is missing, who are the clients? You know, you need to align with the customers. Did you really did a design thinking and see if there is a need of this fancy digital whatever that you want to develop? Are you aware? Have you done that? Most of them, they don't. They get excited because they've discovered an app. Oh my God, this app can really help. But then you're not sure whether do you have a clients for that. And then they start saying, I've designed this app, but I don't have clients. Then I always said, you see, you have designed an app. It can be good designing that app, but now that app that you have designed, you end up having no good service because you don't have a client. And I think this is why we must always start that. Have a design thinking route, whatever. Go and talk to the people. Empathy. I want to design this kind of an app to diagnose tuberculosis. What do you wanted to see? What do you know? All those kind of things. And also, we must also understand in Africa, we are struggling with data. Whenever these people are designing this app, most of them, they also don't put data at the back of the mind, because you don't want your app only to be utilized with the people in the urban. I want to get to the data. I want to get to the data point if we have time a little bit later. But I think you touched on a very important topic there that I want to bring Franck and Prudence and get their point of view, which is designing with empathy, with the end user in mind, and making sure that there is a commercial angle for what you're doing. But my provocative question to Prudence and to Franck is, at the end of the day, who is going to pay for this? Are we designing something with the end user in mind? And is Africa at a maturity level where there is a consumer base that is ready to pay for solutions like the one that Prudence is developing in Sweden? Or are we still stuck in this mindset of developing these health solutions with the view that the government is going to be the one purchasing this?
So I don't know, Franck, what's your take on this? And then I'd love to hear what Prudence has to say.
Yeah. First, I want to say, if you build a solution and your customer are only the government, that's not a good point in Africa. So, because the government don't pay you cash. For example, if you have the government want to pay your device, like 50 device, they will pay, maybe they will not give you the money directly. They will give you the money maybe 1 year after you provide the device. So when you have to, if you're in Africa and you want to make a device to solve a problem in Africa, first you have to ask a question: what's the problem? Yeah, first you have to know what is the problem and how people are doing without your solution. That's the first thing that you have to do. And when you have an answer to your solution, to your question, you have to know if the customer are willing to pay for your device that you have to make, and what's the best price that the psychological price that people can pay for your device. That's really important. And other things, there is what they call use, adoption, and adaption. There is some solution that already exists in Europe, and some entrepreneur just take the same solution and doing the same thing in Africa. And that's not really good, because you have to adapt the solution that you take to other country to adapt it to the reality, the economic and environmental reality of the African countries. So that's really important to know before launch a device.
Super. Prudence, what have been some of the learnings that you've had while building this solution? So if I understand correctly, it's a digital solution focused on Africa to provide healthcare at a distance, right? So here we have a lot of, I'm sure there's a lot of learnings that can be shared with the participants at this hackathon when developing digital solutions cross continents, right? You're talking of different realities, different countries also with different level of digital access and skills. So Prudence, what have been some of the learnings in your journey to develop this application?
Yeah, absolutely. Great question. So I think the most important thing is to understand who are your key stakeholders, who is the customer, who is the beneficiary, because usually with healthcare in Africa, the patient is not necessarily the customer. They're not the ones paying. You need to identify what is the role of the government, and then also what role will the providers play, and what role will your technology contribute to the betterment of healthcare towards your market. So what we've learned so far is that it's important to verify, go out in the market. Once you identify your key stakeholders, you need to verify a lot of assumptions, make iterations, go and verify again. So it's quite a long process, and you need to be very patient. And that's been our journey. We've been working on this since the summer of 2019. So we've had extensive research done. And again, what I would say is the main challenge is, and we will come to the data later, but I'll just mention this quickly, there's fragmented data. So you really need to be on the ground to really talk to your constituencies and understand the need, and understand how you will build a solution that will provide the care and the solution that your customers are looking for. But having said that, what I see as the advice I would give to innovators that are building health-related solutions in Africa is that I see that patient-centric solutions or B2C solutions are the ones that can create a greater impact, because people are willing to pay for convenience. They're willing to pay for a solution that helps them find convenience, that builds trust, that where they feel that they are really receiving the best care options. So patient-centric B2C solutions that are scalable, but also that can be launched to a wider network of users at the same time. People will pay for it. So that's one. The second part that I would say is that when you're building health tech solutions, we need to really recognize that we cannot replace traditional healthcare in Africa. It's not possible. We can only complement, because what we need to focus on is to build solutions that take some of the care out of the point of care to bring it online to provide that access. But there will be certain treatments or certain needs that people will need to go to a point of care to access. So we need to think about how do you build an ecosystem that connects digital health together with traditional healthcare today. So there's in a nutshell, a number of variables that you need to consider when you're building solutions, and you need to build and make iterations. I don't think that ends. And that's been our greatest lesson to this point.
Yeah, I think you bring a good point to this discussion, which is the the point of care, especially if you look at Africa and a population that is increasingly urbanized, probably has better access to physical healthcare, but it's still a continent where a lot of people live in rural environments where access to healthcare is not easy. So what's the panel's, if there is a consensus, I'm not sure if there is a consensus, but what's your view on digital tools to increase accessibility to healthcare in the continent? Are we making these tools in a way that increases the accessibility to healthcare in Africa? Or on the other hand, because these tools are digital, it makes it less accessible because of the lack of know-how, the lack of tools to access some of these new services. So I don't know who wants to answer this, but what's your take on some of these tools that are being built?
Okay, can I take it quickly?
Absolutely, yeah.
Yes, some of these tools, I'm going to talk for South African point of view. Some of these tools that they've been, the beautiful tools, digital, you will see that most of the time, the affordability, accessibility are for those patients that are staying either in the in the urban area. And then when you take the very same tool, that's what they end up going through the telemedicine, whether they can address those issues at the rural area. When you take that, the very same tool that they have sophisticated and designed it to the rural area, it kind of become a problem. That is why if you compare the healthcare system in urban and in the rural, there is that well amongst the two, even if they are in South Africa. You will see that the one in Gauteng province, but in the urban, they even if it's the location, they've got much better healthcare system compared to the one in the rural. And I think this is one of the things that needs to be addressed in Africa.
Absolutely, very good, very good. Franck, I see you nodding. Do you share the same opinion?
Yes, totally. Because the more we have new solution, the more we also have inequalities in the country. So that we can see it in all the country, even with the COVID-19. There are some categories of people that can have the tools that have been created, but other people not. So that is the kind of inequality that technology can bring also in the country. Yeah, not only development, but also inequalities.
Yeah. Mariin, when you were designing your tool and you were designing something that actually has a physical component, how do you design it in a way that you have some of these inclusion topics into the tool? So how do you design something that you make sure that is as accessible as possible to as many people as possible?
Thank you. It's been a topic for us from the start, actually, because looking at our direct and indirect competitors, wearables, they are mostly the ones working already and on the market. They are quite expensive, and people are not willing to pay on top of their main gadget or device that is phone. They're not willing to pay, so we try to keep our unit cost as low as possible, and that the people would get their hands on it faster. And that's why we have this other part of the product as well, which is the lifetime value we're trying to provide. data collection in the app and make it a subscription-based thing. But we want to get the instant help to people sooner, keeping the device something very affordable. But there's another side that the users have said that if it is under some price, some specific price, which I can't say, they're not willing to pay for it because they don't trust it. That's the thing about technologies, that they have to be willing to trust it with the price, but they don't want to pay too much. So there's a yeah.
I think it was something that Franck already mentioned about this sort of psychological price that people associate with something that provides enough value for them to consider it to be serious, right? Mm-hmm.
Lifetime value, not something that you use temporarily.
Yeah. So I think, it has already been mentioned by several of the panelists, the topic of data, right? So let's bring this topic of data and how, also in the interviews we had before, we talked about how health data is missing. There's data gaps in Africa when it comes to health data. And I'd like to bring Isabella to the discussion and perhaps the perspective from Europe about some of these topics and some of the tools and some of the solutions and perhaps some of the frameworks to deal with health data and all the issues surrounding it. So Isabella, what's your take on this?
Thank you for the question. Well, needless to say that data and information exchange became the new black, right? And what we have observed as a medical technology industry, especially during the pandemic, is that the healthcare transformation depends on the exchange of data and information. Therefore, no matter who decides, policymakers, this is who I mean, should put in place framework in order to ensure that the exchange and the development of data and information happen in the most secure way as possible. Mm-hmm. Patients need to be protected, right?
Absolutely.
And at the same time, innovations need to happen. So let's say if I were an advisor for any policymaker, I would stress out these two aspects: protect patients, but at the same time make sure that innovation does its course, its development.
Super. I think that's very solid advice to not only policymakers, but I think also the teams that are building new solutions. And Prudence, how did you guys tackle this issue of data in this field of providing healthcare in Africa? What was your approach?
Yes, great question. So as a Swedish company, we are GDPR compliant because the data that we are gathering and storing, whether it's data about hospitals in Africa, data about patients and the disease areas that we're working with, data about our customers and the payers, we have to ensure that it's stored in a manner that is compliant. So due to lack of a Pan-African framework right now within data protection, we have to use a GDPR, because we're building Mangea Health not only for Africans in Africa, but also Africans abroad who play a major role in healthcare financing back home. So what we've done is we are following the developments in Africa. I know that the African Union is currently developing a framework around data protection, how do you protect patient data, but also storage of data. So when we're building solutions, especially with digital healthcare, and I've seen ideas where you want to create sort of like a referral system where you can refer patients from one hospital to another across borders. That's a lot of data that is moving. So with lack of really like a solid framework, I think that a lot of startups are just doing what they can as best as they can. But I see also individual countries like Kenya and Rwanda developing their own in-house policies around digital healthcare. So that's a great start. But in our case, we are working with GDPR at this stage.
Makes sense. Franck and Professor Motaung, what's your view on this data issue and data protection and privacy?
Let me just start there. I think for me, the issue with the data, one of the things that I always said with the policymakers and the data, usually they don't always work together. And I think these are the challenges that we've got in South Africa. Policymakers, they are there, allow me to use this word, politician, sitting there, making a decision. Okay, now you've got people like Prudence, people like Franck that are busy, doing this data thing that can assist because they understand the assembly thing. And after that, they wanted to say to them, guys, let's work together. That is where the problem starts. For me, I always said, when you really, which is my dream, to take this better, whatever the data guys, gadgets, whatever they're going to do, let's learn to work together. Let's bring them on board so that they can start understanding. Because once you're working there in silo alone and you want them, because at the end of the day, they are the one that's going to make a decision. So I think we just need to start. I've already started doing that anyway in South Africa, where I see an opportunity. I will invite them, just to start knowing what we are doing, because they are the one that either they will accept it or they're not going to accept it. Let me just stop there.
Makes sense. And Franck, what's your view?
It was really hard for us to have data, for example, because we have to build a data for medicine, and it was really hard in Africa. So what I wrote in 2019, a proposition of solution to the African Union about the data, how African Union, what African country should do to have a Pan-African database. And one of the first things that I proposed to the African Union is that we need to developing countries, so African countries need to work toward universal internet access to ensure that all their citizens have opportunity to learn the skills to be more ready for the technology, the frontier technologies. So that's really important. And if you don't have internet access, you will not have also digitalization cannot be possible. And if digitalization is not possible, you cannot transform your paper to a data that can be accessed to everyone.
Mm-hmm. Yeah, that makes a lot of sense. And I think, the topic of data is not one that has an easy solution, as we know that when you're talking about data transfer between institutions, between different countries, there's a lot of different aspects to take into account. But I think, making the right steps in the right direction, we see some progress here. We're coming towards the end of the panel, but there's still a couple of topics that I would like to talk about. Prudence mentioned very, very briefly on the topic of the business models for some of these startups. We already talked a little bit about in the beginning, are you selling to consumers? Are you selling to the B2B sector? So I think, Prudence, you had an interesting take on that about the African diaspora and how they can be part of the solution for some of these solutions. So maybe you just expand on that a little bit, because the topic that I really want to get into is the topic of mental health and how, during the pandemic, this has come kind of like to the forefront of the health and wellness topic. So Prudence, perhaps just briefly talk a little bit about this involving the diaspora on the business model of what you're trying to do.
Yes, absolutely. So like I mentioned earlier, we really had to dig into the idea itself, the technology, but also how do you deploy it? Who are the key stakeholders in this? Who is paying for what? So our focus is on chronic disease conditions and helping families in Africa access specialized care options, which is the key word, options, whether you want to get a second opinion or you want to get advanced treatment, or if it's management or palliative care. And we see that the diaspora community plays a critical role, because in Europe, for example, there's 8.7 million Africans that are sending $23 billion back home every year, out of pocket, supporting their families with medical bills, education, investing in infrastructure. But they're so far away from these services. So when we talk about also on the flip side, connectivity back home, some of those challenges with people that do not have access to the internet or don't have access to smartphones and cannot access digital health services, if they have friends or family in the diaspora that can run the process for them and then just send forward the information, whether it's booking an appointment, finding them the right doctor, finding them the right care options, and then they just transmit that information to them. So we see the diaspora community here as a key component. That's one, but more specifically, for example, there's more African doctors in France and London than you have in some countries in Africa. So there's over 30,000 doctors working in Europe today, and they have family members back home that are looking for the best care options. And these doctors want to get involved. They want to get involved in providing services. So I will go back to what I said in the beginning. Solutions, healthcare solutions that build an ecosystem around the key stakeholders when it comes to access, affordability, and management of care, distribution in Africa are the ones that are going to have a greater impact. And that's what we're trying to do.
Super.
Right now.
Thank you for that perspective. I think it really opens a lot of opportunities for what some of the teams might be building during this hackathon. But before we close it off, I would really like to bring in this point about mental health. Since the pandemic has started, we've seen a lot more awareness being brought to this topic, not just in Europe, but I think across the globe. So what are some of the main issues that we see also as challenges and opportunities for some of the startups working on this? And Mariin, obviously, I want to start with you, since the product you're working on, the project you're working, has to deal with mental health. So what's your take on this specific topic?
Thank you. As we discussed previously as well, the solutions are coming up like mushrooms after the rain. Mental health solutions, like a decade ago, it was a million game. Now it's over a billion. It's a few billion already at the market. So a lot of startups come up that do mental health solutions, but I think there's a big difference, and it's a differentiation between consumer market and business market, B2B as well, is that one is one we can name wellness, which helps monitor your general health or mental health. The other thing is that there is a medical care, and where's the line? So the problem now is that so many solutions are coming up, but it's hard to make draw a line between where does health, actual medical health, help starts and the wellness ends, and this is a bit foggy area there. So, and the other thing is that a lot of us are making solutions for consumers or businesses, but not a lot of solutions are bringing the data together, which has been previously mentioned here as well. We are not connecting to mental health specialists enough and how to actually make it work with APIs and create a clean data transfer.
Exactly. I don't know, does anyone else have some input on this mental health topic that they would like to bring to the discussion?
Yeah.
Yes. Oh, okay. Go ahead.
No, I just wanted to say, I think mental health is a really good topic, because in Africa, some person think mental health, when we speak about mental health, is the person is weak. The person don't want to say aloud that, okay, I'm suffer, and I think it's really something that need to be, we need to speak a lot in Africa. And I don't want to, I'm not a specialist on mental health, but I think, yes.
Yeah. I think you're absolutely right. Yeah. Professor?
Yes, I think mental health, people used to view as if it's only for those people that are really can I use the word crazy, that they can go to be admitted in the hospital psychiatry. But I think from COVID, we learn a lot that it has really shows us that it was not only that, the way we understood it, even professional people, even us or whatever, it really affected us mentally, not that we have to go and take drugs. And it was a very serious thing, because, I mean, to stay not going anywhere in the house, doing nothing, not going to go, you know, that was really affecting a lot of us, and also affecting the businesses as well. And I guess because of when you, and then I think the startup, they need now to start always have a backup in their company. COVID has taught us a lesson. And I guess the reason why we were also frustrated and mentally affected, nobody could always plan a backup. You know, you always thinking that success, I'm going to do well, I'm going to do well. You didn't plan about looking at the pestle, you know, where you always have to look at the political, the environmental, the legal, the social aspects. We don't usually do that when we do the strategy or whatever in our company. And I think this is one of the things that I can also add in terms of the startup, that, you know, you might need somebody, you've built a prototype and then you want to take it further. What is the strategy to take that prototype further that you've already built? And then what is going to be included into that? And I think these are the kind of things that needs to be also be incorporated.
I love the way that you connect this topic of mental health and also what the teams are working on during the hackathon. Having said that, and just as final words, because we're really running out of time, Isabella, some words of encouragement to the teams working on the hackathon?
Yes, absolutely. Well, of course, be creative, think out of the box. Don't be scared of looking at something which still does not exist, and involve as much as possible patients, users, but also the healthcare professionals. Usability and implementation are key to address the challenge of inequality of access, and digital solutions can really help to do so. So yeah, this would be my wish.
Thank you. And I would like to thank all the panelists that were so active today talking about health and wellness. And once again, my sincere thank you to all of you who came here to watch, and all the teams that are working on this topic during the hackathon. So best of luck to all the participants. Hope you guys make some great prototypes that we're all very eager to see on Sunday, and I hope the panelists are following the final to see the best ideas coming out of this hackathon, and best of luck and success to all of you. And once again, to my dear panelists, thank you for joining me in this discussion, and hope to see you soon in lots of health, and stay safe and stay sane.
Thank you.
Thank you so much.
Thank you, everybody.
Bye-bye.
Thank you.
Bye-bye.
Bye.
And join us very soon. We will have the next panel discussion in about 5 minutes time, where we will be continuing the conference. So catch you all very, very soon.
Ora ho tolto il video, però